Hello everyone, I'm Dr. Chetna Panbaka, consultant dermatologist and aesthetic physician working at Maxcure Hospital Secretariat branch. Today we are going to talk about baldness. Baldness, nowadays we see a lot of people complaining coming to the dermatologist and saying that they're losing lot of hair. Now we have to decide what kind of hair loss a person is having when they come to us. We have two kinds of hair loss. One is a scarring alopecia. Alopecia means hair loss. So we have scarring alopecia, the other one is a non-scarring alopecia. The scarring alopecia is a result of any skin disease occurring over the scalp like SLE, otherwise any trauma, infection. The follicles get damaged and resulting into scarring. And non-scarring is androgenetic alopecia, alopecia areata, telogen effluvium. These are the non-scarring where the person just loses the hair. And now today we will talk about more commonly the baldness, that is also known as androgenetic alopecia. First, I would like to differentiate between the androgenetic alopecia, alopecia areata and telogen effluvium. Alopecia areata is patchy hair loss where you can see only patches of hair loss patients lose in those areas alone, and it is more related to atopic thyroid disorder, any autoimmune condition, which is non-scarring. The next one is the telogen effluvium. Telogen effluvium occurs in patients where they have lot of the follicular activity is decreased, pushing the anagen phase to the telogen phase. Now, what are the causes? That could be because of any stress, postpartum after delivery, otherwise any post-surgery, then because of any medication, thyroid disorders or anemia. So these are iron deficiency anemias. So these all can cause telogen effluvium. Now coming to the androgenetic alopecia, which is also known as baldness, we have to realize that there are three cycles in the hair growth. One is the anagen phase, where 90% of the hair is on, for all of us, is in the anagen phase, which is the growing phase, then which lasts for 2 to 7 years. The other one is the catagen phase. This catagen phase, around 1% to 3% lies in the catagen phase, and it is a regressing phase, which means the follicle activity is decreased and the production of the pigmentation also decreases. And during this phase, the dermal papilla gets moved upwards. The last one is the telogen phase, is the resting phase. It is in this phase that the hair tends to fall, and usually around we see which lasts for 3 months. So what happens during this androgenetic alopecia, or why this baldness occurs? One, because of there is testosterone is getting converted to dihydrotestosterone in the presence of 5-alpha reductase enzyme. So now this people who have this baldness, they have increased levels of androgen, 5-alpha reductase enzyme, as well as the dihydrotestosterone in the scalp in more quantity. So this causes baldness. This baldness, it is genetic and autosomal dominant type of hereditary pattern. Now coming to what is happening in this androgenetic alopecia, there is miniaturization of the hair, which means that anagen phase, it is determined by the length of the hair. When this long hair becomes shorter and the terminal hair, so all of us have in the hair, scalp hair, body hair, all these are terminal hair. It becomes vellus hair, which means fine hair, which we see in babies, and it becomes non-pigmented. The dark color, the black color becomes non-pigmented to grayish hair. All this they are features of this androgenetic alopecia. Now we have the two kinds. One is the male pattern hair loss, the other one is the female pattern hair loss. A male pattern hair loss, we have types which is in the Hamilton classification. Basically what happens, there is the receding of the frontoparietal hairline. So this goes down, then slowly this decreases, this frontal hairline decreases, and thus leaving only the occipital region. And in female pattern hair loss, according to Ludwig's classification, there are 3 grades. One, initially it starts of the central parting, then the parting gets widened, and then there is diffuse thinning of the hair. Now coming to how do we investigate when the patient comes to us. We do certain tests like hair pull test, where around 60 hairs are pulled, less than 6 which we gets removed from the hand, it is negative. More than 6 is positive. One has to remember that a lot of people get scared and they say that a lot of hair is getting lost. We have to know that less than 100 per day is usually normal. Apart from that, we do something called trichoscopy, where we see the follicle and the pigmentation and the hair density diameter. Next, we come to certain investigations which we have to rule out other causes of hair loss. One is to do a complete blood profile like hemoglobin, to look for iron deficiency anemia, do serum ferritin, iron levels, total iron binding capacity. Next, we can do even thyroid profile and zinc levels. The other thing we have to rule out in females is a PCOD, and in that case, people who are having irregular menstrual cycle also complain of lot of acne over the face, that is pimples, as well as thinning of the hair. So in those patients, we have to rule out PCOD, and by doing an ultrasound or doing the hormonal levels like dihydroepiandrosterone, prolactin levels, and other hormonal levels. Now coming to the treatment, we have the topical and systemic. Topical are those things which we have to apply, like minoxidil, which is the FDA approved. Minoxidil is available in various forms like lotion, gel, or sprays. It is available in various strengths like 2%, 5%, and 10%. 2% is commonly used in females, 5% is more commonly used in males, and less commonly in females, with caution, because they can tend to develop increased facial hair. 10% is commonly used in males. Now this coming to the application of minoxidil, we have to apply the minoxidil 1 ml depending upon the strength, 1 ml on each side of the scalp, so half side in the morning and the other half side in the evening. This minoxidil has to be applied at least when the hair is dry and not when it is very sweaty or it is wet. One has to remember that certain hair growth, certain hair fall can occur up to 8 weeks and increased hair growth, and we shouldn't get scared but continue using the minoxidil. Nowadays, minoxidil is available in the market with various other combinations like tretinoin, finasteride, or aminexil. These are also added to improve the hair growth. How does this minoxidil improve? Is basically it increases the vascular permeability, resulting in vasodilatation and better blood supply to the hair follicle so that the hair grows. The next one is any other lotions like which contain niacinamide and ketoconazole shampoos. There are certain promoters of hair which which causes this activation of the dermal papilla, like hibiscus, retinoids, iron supplements, millet seeds, ginkgo biloba, or aloe vera. Then the next common, we can take even tablets in the form of vitamins which contain biotin. Then most commonly we use in males is the finasteride. Finasteride, lot of people are scared to use because of the various side effects which are mentioned on the internet, like loss of impotence or sterility, but it has nothing it's just a myth. Now this finasteride has to be taken as 1 mg for the people who are developing this androgenetic alopecia. Finasteride acts, it is a 5-alpha reductase inhibitor, thus it inhibits the conversion of testosterone to dihydrotestosterone, which causes the miniaturization of the hair. Apart from this, we have certain procedures which we can do. One is the PRP technique. The PRP technique is we have to take certain amount of blood from your body. We do a centrifuge and separate the platelets, which has a rich in growth factors. These platelets are again re-injected into the scalp so that there is better hair growth. This can be done once a month to up to 6 to 8 months. Even if you are doing this procedure, we have to use a minoxidil, and the other supplements which are to be taken are important. So the other technique is the hair transplant, where we can improve the frontal hairline and increase the growth density over the areas where there is loss of hair. The most commonly is the FU technique which they do. Next we have the light therapy around 650 to 900 nanometers. There are light helmets also where which causes follicular stimulation and hair growth. Nowadays a lot of people are using botulinum toxin also to inject in the scalp, which relaxes the scalp and thus improving the vascular permeability also to the scalp for better hair growth. Even diet also can also help in certain food items also can help in preventing hair loss, like beans, nuts, milk, seafood, green leafy vegetables. And another reason is you have to check if the patient is having dandruff also, because that can also lead to lot of hair loss. So you have to use an anti-dandruff shampoo accordingly. At the end, I would like to conclude by saying that do not go for the treatment provided by the quacks or a non-dermatologist. You have to come to a skin doctor for a better and good treatment for your hair growth. Thank you.